A 32-year-old woman comes to the office for infertility evaluation. She has been experiencing irregular menstrual cycles and has been unable to conceive despite 3 years of unprotected intercourse. She has a BMI of 35 and bilateral enlarged ovaries. She is prescribed letrozole for ovulation induction therapy. Which of the following is the mechanism of action of this medication? Now, this patient is presenting with signs of PCOS. PCOS is a common cause of infertility due to anovulation. Now, letrozole and clomiphene are going to be ovulation-inducing agents that can be used in PCOS, and they're going to work by increasing levels of FSH and LH, which are going to be hormones that is going to stimulate ovulation. Now, the way I like to remember the mechanism of actions for letrozole and clomiphene is by looking at the RO in letrozole, and this reminds me that letrozole is an aromatase inhibitor. When I look at clomiphene, I look at the P and the H, and this reminds me that clomiphene is going to deplete the pituitary and the hypothalamus estrogen receptors. Now, the mnemonic that you can use to remember that letrozole and clomiphene are going to be used in patients that are trying to get pregnant is that letrozole and clomiphene are like a lucky clove because they let you become pregnant. Now, let's first discuss the pathophysiology of PCOS because it is important in this question. Now, the pathophysiology of PCOS is not clearly understood, but what we do know is that there is elevated insulin levels in these patients that is going to lead to GnRH gene overexpression, and this ultimately elevates LH to FSH ratio, and this gives us high androgen levels. Now, remember that LH can stimulate the theca interna cells to convert cholesterol into androgens, and androgens can be converted into estrogen in the ovaries with the enzyme aromatase. Now, what is important to know is that patients with PCOS tend to have high BMI. And this is important because in adipose cells, in fat cells, we can also convert androgens into estrogen with the enzyme aromatase. So ultimately, patients with PCOS have high estrogen levels. Now, this is important because estrogen can give a negative feedback into the hypothalamus and the anterior pituitary, and this can ultimately decrease levels of FSH, LH, and GnRH. And this is important because this is going to deplete these hormones when we need them in order to produce ovulation during the menstrual cycle. Now, the way letrozole is going to work is by inhibiting the enzyme aromatase. And this is ultimately going to decrease levels of estrogen to prevent this negative feedback going into the anterior pituitary and the hypothalamus. And so this is going to increase levels of GnRH and FSH. And with the increase in FSH levels, we can actually form a dominant follicle that can ovulate and release the oocyte for fertilization. So this is how letrozole is going to help patients with PCOS by inhibiting aromatase. And by inhibiting aromatase, we're going to get decrease in estrogen levels. And remember that when we have decrease in estrogen levels, we're not going to get this negative feedback from estrogen to the anterior pituitary and the hypothalamus. So this is ultimately going to increase levels of FSH and LH. And with patients with PCOS, the increase in FSH is especially important because they usually have these follicles that are not able to mature due to low levels of FSH. So when we increase the FSH levels, we're going to be able to form a dominant follicle that can ovulate and release an oocyte for it to be fertilized. Now, clomiphene is going to work on the anterior pituitary and the hypothalamus. And the way it works is that it basically occupies these estrogen receptors in the hypothalamus and the anterior pituitary. So now, because these estrogen receptors are occupied, it is not able to receive a negative feedback signal from the estrogen. So because we're not able to receive a negative feedback signal from the estrogen due to the occupation of these receptors by clomiphene, we can increase levels of FSH and GnRH. And again, with increase in FSH, we're able to form a dominant follicle that can ovulate and release an oocyte for fertilization. So to answer the question, the correct answer is going to be answer choice D, which is going to be suppression of ovarian estradiol production.